Okay. Hello, my name is Simi Tunasescu,
Hi, my name is Melissa Granados.
Hi, my name is Lula Lian.
Hi, my name is Georgia Silva.
Hi, my name is Chen.
and we're going over surgical site infections of Escherichia bacteria. Um, so to start off with an introduction, what is the importance in researching surgical site infections? Well, one big thing is that cervical site infections play a large role in causing patients to have an increase in the duration of their hospital stay. Cervical site infections make up as much as 25% of hospital-acquired infections. So 25% of people who acquire a hospital infection received one simply from the result of a surgery intended to of the betterment of their life. So on top of patients having to go through the recovery process of the surgery they have already gone through, they will also have to endure the complications involved with having a surgical site infection. This will not only set back their body's healing process, but various other symptoms will arise depending on the type of infection they contracted. E.Coli is the second most common pathogen found in surgical site infections, and it causes various undesirable symptoms. Though E.Coli is a common microorganism, can be found within the gut of the human body. If found anywhere else in the body, it can easily become problematic. Symptoms include swelling, redness, pus, pain, as well as a foul odor at the infected cervical sites. This causes an increase in required treatment that, along with the prolonged stay, will result in a costly hospital stay.
Some background knowledge for E. coli is that E. coli is a gram-negative bacillus that is naturally found in our intestines, where it plays a helpful role in digestion. But when E. coli escapes our intestines, it becomes a real problem. For example, it is a leading cause of extraintestinal infections like UTI and even pneumonia. When it comes to surgical site infections, E. coli poses a significant challenge. Studies show that about 5% of patients develop an SSI. During surgery, the stress on the body alters the gut's natural barrier, and this allows bacteria like E. coli to multiply more easily in the early hours after surgery. On top of that, surgical sites can become contaminated by bacteria from either the patient's own body or from the environment, sparking an immune response. That's why infection prevention measures like the proper use of antibiotics and maintaining a sterile techniques are so critical. In our presentation, we'll also touch on recent advancements in this area and explore how they're helping to reduce the risk of SSIs caused by E. coli.
For the method one, it's about pathogenic mechanisms of E. coli and its related technologies. E. coli is a bacteria that plays a key role in many applications. We can see the third photo that E. coli has special structure called pili. This pili allowed E. coli to attach to tissues, colonize the seeds of infection and form to biofilm. This biofilm could serve a protective barrier for the immune system, but also creates an environment for the release of toxins. These toxins can cause symptoms such as tissue damage, fever, redness, and pus formation. To better understand this process, a control study was conducted on rats' intestinal samples, collected at three time periods, 6, 12, and 24 hours after surgery. This timeline allows the tracking of E. coli adhesion and the biofilm activity over time. The data shows that bacterial adhesion and the biofilm formation peak 12 hours after surgery and then gradually decline, returning to basic levels after 24 hours. This observation paves the insights into the timing of bacterial activity during infection. To further investigate these mechanisms, advanced microscopy and immunostaining techniques can be used to visualize biofilm density and the complex pili structure. In addition, enzyme-linked immunosorbent assay was used to quantify toxins levels in infected tissues. These methods help demonstrate how E. coli can cause harm to body and after surgery and the relation between E. coli activity and the host the immune response.
Another method in preventing chances of surgical site infections involves a prophylactic antibiotic injection done prior to surgery. What happens is cefazolin is intravenously administered into the body about 30 to 60 minutes prior to surgery. This drug is intended to prevent gram-positive and gram-negative bacterial infection, which includes E. coli. For patients who have a high risk of infection of multi-drug resistant E. coli, ertapenem may also be used as an increased preventative measure. Throughout the entire process of surgery, aseptic techniques are strictly adhered to. Such techniques involve maintaining a sterile environment through the use of sterile equipment, using antiseptic solutions to prep the skin prior to incision, as well as maintaining the sterile integrity of all personnel involved. Post-op procedures will involve sterile wound care, antiseptic use, and changing of dressings when necessary to avoid potential buildup of bacteria. The goal is to maintain consistent cleanliness so that E. coli cannot have a chance to cause infection, since they will be unable to make contact with open wounds from surgery. As seen in the first photo of E. coli anatomy, their pili stick out of their cell body and would need to make direct contact in order to attach themselves to the skin. With these combined measures of antibiotics and consistent sterility throughout the surgical processes, including post-op regulations, the occurrence of surgical site infections will be greatly minimized.
To manage E. coli surgical site infections, method 3 uses a combination of targeted antibiotic therapy and a wound care regimen to address bacterial presence and promote healing. First, initial treatment with a broad-spectrum antibiotic such as ceftriaxone shown in Figure 2. It covers E. coli and other common bacteria. Following tests on culture and the response of bacteria, adjustments are made in treatment. Carbapenems are used for strains that produce extended spectrum beta-lactamase, while resistant into carbapenems is treated with colchicine or tigecycline. The meticulous wound care is performed. This includes debridement to remove dead tissue and ensure that the wound environment remains conducive to healing while resisting further bacteria colonization. Abscesses are drained in clean conditions to lower the number of bacteria. And antimicrobial dressings are used to create a barrier against refraction. For bigger, slow healing wounds, negative pressure wound therapy helps speed up the growth of new tissue and healing.
To summarize our research on surgical site infections, we know that E. coli is a common microbe that can invade our surgical site infections. Although E. coli is known to commonly live in the human gut, it can become pathogenic towards surgical incisions, which account for 20% of hospital-acquired infections. When E. coli becomes pathogenic, it is able to adhere to tissue surfaces, going through epithelial tissue, and this is what causes an inflammatory response by our immune systems. And that's basically why we see redness, we see pus, and we see inflammation at the surgical site. To continue future research on surgical sites infections, antibiotics like ceftriaxone are being studied as resistant strains. Wound care techniques are also proven to decrease the invasion of E. coli and other microbes. Also, a specific wound technique is negative pressure wound therapy. And overall, this future research is focused on preventing such infections and how we can improve antibiotic resistance, such as enhancing biofilm disruption strategies. Thank you.